Well, so far in the limited time I've used with Scotchbond Universal, I've done both direct restorations, primarily posterior composites, and then I've also done a few posterior ceramic restorations using it as part of the cementation process. I think the opportunity to use one adhesive for both of the tooth preparation processes is going to make doctors rethink how they go about things. In the past, we've always had to consider those two separate categories of materials. And so now being given the opportunity that with one material I can titrate its use, whether I want to etch the enamel to enhance the bond there or whether I want to use it totally as a self-etch product, is a pretty interesting and thought-provoking concept that's going to take some people some time to figure out, does it actually do what the claims are? Well, probably the main advantage of Scotchbond Universal is that versatility. Instead of having to keep track of several different product lines in order to accomplish different procedures, such as a direct procedure or an indirect procedure where I'm concerned about filler particle load or something of that nature, I now can take advantage of having a single line of product. In the past, especially in the indirect side where I do most of my work, it's been very careful to titrate the type of bond you desire relative to the cavity preparation. So for example, if I had a cavity preparation that had a lot of resistance form in it, I wasn't so worried about the bond strength as much, and so maybe the concern about post-op sensitivity was a little bit higher, and I'd want to end up doing maybe more a self-etch procedure because of that. Then if I happen to have a more adhesive preparation where retention was really important to the success of that restoration, I'd use more of a total etch concept. Yeah, maybe a little bit more risk of post-op sensitivity, but I needed that bond strength for success. And now with Scotchbond Universal Bond, I can get that convenience of the self-etch process, and if I need the extra bond, I can do just the total etch process, use the same product line, and it works out to my advantage. Well, I think Scotchbond Universal is not the same. I mean, it's a different category of material because it's the only one offering a way to titrate its use with the same product. The other products that I use are a self-etch product or a total etch product, and there is a specific line of adhesive agents or cements that come into that category that you don't mix and match. And now I have an opportunity that instead of having to carry those different product lines, I can move to a single product and titrate its use based on how I want it to function. Well, I'm not sure I'm really good at predicting how people will decide to change what they do, but I think I know one thing, in that the Scotchbond Universal Bond is going to force clinicians to rethink why they choose the products that they do. Like I said, most of the time when we choose these adhesive agents, it's with the end point in mind of sensitivity and bond strength, and usually we have to trade one for the other, especially when you put in efficiency. You know, nobody would argue that the total etch process is the most efficient process relative to time involved. So we've also had to look at, it's a trade-off. Most of the time when we think of total etch, we're going to get maximum bond strength. And we realize we're going to have to invest a little bit more time and effort to get that. You move to the self-etch where maybe you were concerned about post-operative sensitivity, and now, yeah, it was more efficient, and that was a nice positive, but you kind of gave up a little bit of the bond strength. And now we're getting that efficiency in working with a single product, that if I want a little bit bump in bond strength, all I have to do is use the etching step, but I don't have to change products. And I think that's going to make people rethink some of their choices that they've done. I don't think it's going to necessarily alter what they think is important. I think the difference is, instead of having to buy different products to satisfy different goals, you may be able to have a single product satisfy multiple goals, which we really haven't had much of an opportunity to do in dentistry.